In coming months, I have a number of ideas for posts on the various anxiety disorders, but there are some ideas that apply across most of these types of problems, and this is one of them. Whether you're talking about panic disorder, agoraphobia, obsessive-compulsive disorder, social anxiety, specific phobia, generalized anxiety disorder, or to some extent post-traumatic stress, there are two overarching categories of symptoms that are part of the picture: anxiety and avoidance. Anxiety is the emotional component of these difficulties, and avoidance is typically the behavioral component. So let's think about those. First, the anxiety. Now, often the problem isn't really anxiety so much as fear. It's an elevation of the stress response, which is also called the fight or flight response. If a person has the fight response, they typically feel angry and behave aggressively. So let's set that to one side. The flight response is more associated with fear or anxiety and an overwhelming urge to get the hell away from whatever's making you anxious. And you can see that there's an obvious evolutionary advantage to this. If there's a saber-toothed tiger near your cave, you don't want to be going, "Nice kitty, look at the pretty fur," right? The person who gets away is more likely to survive and pass their genes on to the future. So we've evolved this tendency to try and escape the things that activate our flight response. Fear is what we experience when it seems reasonably clear what to do. Get out that door. Stay away from that animal. Back away from that cliff edge. So most simple or specific phobias involve fear. You want to run away from that high place. You know, the dangerous looking dog, the scary elevator, the creepy snake, whatever. Right? Anxiety feels roughly similar, but has the added component that it's not entirely clear what to do. So it has the emotional component, but the directional feature is missing. Do I want to be around people? Do I not? Is it better to say hello in this situation or stay in the background? And so on. So there's often an element of indecision in anxiety. But for most intents and purposes, we can treat fear and anxiety as similar. Okay, so that's the anxiety. The avoidance is the act of actually staying away or getting away from what makes you anxious. You don't go over bridges, you turn down party invitations, you never use public washrooms, you avoid any place you've had a panic attack, you use stairs rather than elevators, whatever. In the case of obsessive-compulsive disorder, you usually perform some kind of behavior like checking the locks 5 times, or saying a prayer exactly right, or touching the stove repeatedly before you go out, as a way of reassuring yourself that what you fear won't actually happen, or as a way of just getting the anxiety-producing thought out of your head. But these behaviors are all a kind of avoidance. In health anxiety, you might be fearful of having a deadly disease. So some people with health anxiety avoid doctors and hospitals and ambulances and any reminder of the medical world. Others actually seek all those things out to get reassured that they're not really sick. So they might be going to the emergency room or constantly asking their cousin, who's a nurse, "Does this look like skin cancer?" over and over and over again. This too is a kind of avoidance because you're trying to get away from the anxiety about whether you're sick or not. Now, the anxiety usually feels awful. It's an unpleasant sensation. I don't need to tell you that because you've experienced plenty of anxiety in your life, because you're human and humans feel anxiety. It's standard equipment. But if you have an anxiety disorder, you usually have more of it. The thing about the avoidance is that it tends to feel good. Every time your cousin tells you that you're fine, every time that you use a route that avoids bridges, Every time you get away from the scary shopping mall, or you do a tidying ritual in your living room, you feel a little better, at least for the short term. So we love the avoidance, and it feels like our best friend, our best coping strategy. So imagine you're a therapist and someone comes to see you with an anxiety disorder. It's more complicated than I've said, but essentially this person has anxiety, which they hate, and avoidance, which they kind of like and helps them get by. Which of these two is the bigger problem? The anxiety or the avoidance? The answer to that question is the reason that anxiety disorders are so tricky. And usually it's why they get so bad before people seek help. Everything this person is doing is designed to reduce the anxiety. But the anxiety is not the key to the problem. It's the avoidance. You see, the more you try to shrink the anxiety, the more you convince yourself that anxiety is really dangerous, that you cannot handle it, that you have to make it go away. And you also make what you're frightened of a little bit more scary every time. I'll give you an example. Take somebody who's been bitten by a dog. So now they're a bit anxious around dogs. Let's spend 1 year helping them to avoid dogs. We'll figure out which of their friends have dogs, and we'll never go to those houses. We'll map out all the dog parks, and we'll make sure they're always 2 blocks or more away from one. We'll look at television shows to identify the ones that have dogs in them. We won't watch those. And we'll always have an escape route in mind, so that if we run into a dog, despite all our efforts, we can get away quickly and feel all that wonderful relief. At the end of the year, is this person's fear of dogs less or more? Better or worse? Virtually for sure, it's worse. In fact, what I have mapped out there is exactly what we would do if we wanted to take some understandable nervousness around dogs and turn it into a full-blown disabling phobia. How did this problem get so bad? Because we were trying to make it better. If we weren't trying to make it better, it wouldn't be worse. It's the avoidance of what we fear that gives fear control over our lives. And putting fear in the driver's seat of our lives makes it more and more powerful. Now, obviously I'm talking about irrational fears here. If you feel nervous about cliff diving into water that might be too shallow, good, that's fine. Avoid doing that. You don't want to pick up rattlesnakes. Terrific. You don't want to try heroin. I'm glad, right? But where your fear response is completely out of proportion to the danger of the situation, the avoidance tends to magnify the fear. The thing about this is that the avoidance doesn't necessarily end when you seek treatment. A lot of people with social anxiety have learned to self-medicate because what they're really trying to avoid is the anxiety itself. That's the worst part. And they do it by drinking alcohol. There's a reason they do that. It works. Alcohol tends to reduce social anxiety. The problem, well, you can see it, right? Alcohol is the avoidance strategy. And the more you do it, the worse the anxiety tends to get. Plus, then you wind up getting addicted to alcohol, and now you got 2 problems instead of 1. So, again, what happens in treatment? Well, a lot of the approach, if we're not careful, can be targeting the anxiety, not targeting the avoidance. So we wind up doing relaxation exercises. We do diaphragmatic breathing. Maybe you get a prescription for anti-anxiety medication. You identify your imaginary safe place that you can go to or pretend to go to if you're anxious. even a lot of meditation and massage and Reiki and alternative medicine and psychotherapy are all focused on managing and reducing the anxiety. Now, believe me, I'm a great fan of meditation and massage and therapy and, yes, diaphragmatic breathing. They are all useful, but they're useful mainly in enabling you to work on the avoidance, which is the real problem. If you have something you fear irrationally, your mental stance is to turn your back on it and run away. But the more you do that, the worse you make the problem. Effective treatment means turning around and moving slowly and deliberately toward what you fear. And the more we can do that, the less fear there is. So we can actually reduce the anxiety by not working on it and focusing on the avoidance instead. Now, this video is too short to tell you all about the strategy for overcoming avoidance. There are a lot of technical bits to it and ways of using things like breathing and mindfulness to help you out. And some perfectly common sense ideas like just pushing through and doing your best, hanging around dogs as long as you can before you run away. These also make the problem worse. Overcoming excessive anxiety usually involves doing some things that don't feel intuitively right. So do not take this as a roadmap for how to overcome your own excess anxiety. If it's a significant problem in your life, you may well need professional help to tailor the ideas to your own situation. You can read self-help books and watch YouTube videos all you like, but that's not a substitute for tailored coaching from a qualified healthcare professional. The take-home point from all of this is just that basic observation. So-called anxiety problems involve two components: anxiety and avoidance. Anxiety feels like the place to work. Usually it isn't. The key is to change the focus and emphasize the avoidance instead. And you'll see how this plays out in future videos about the various anxiety-related problems.